which is closing the gap in healthcare coverage with the Affordable Care Act, or ACA, as you'll hear called. All right, so let's go ahead and get into it. So the Affordable Care Act, ACA, also known as Obamacare, was signed into law in March 2010. It was designed to extend health coverage to millions of uninsured Americans. The ACA had three primary goals: increasing the number of insured, improving the quality of care, and reducing the cost of health care. You will examine the ACA and write a paper discussing the effectiveness of the legislation. So yes, this was one of the biggest legislative doctrines in healthcare, probably dating back to the 70s with the Health Maintenance Organization Act back then. Assignment instructions. Review the following case, Harvard Business Review. So click here and it'll open a new tab. It may take a minute to get going, but just click it, it'll open a new tab. Do further research, i.e. more than just that one, of the Affordable Care Act. Then based on your research, write an opinion paper that is following. So an opinion paper is just that, it's your opinion. Now when you typically do an academic paper, it's considered a research paper, and it's written third person like most of your business writing. So an opinion paper is written in the first person because it's your opinion. I believe this, I believe that type of thing. So it is different than how you normally write. Okay, so as we take a look at the instructions, the three main components with the two sub-bullets here. Number one, has the ACA had a positive or negative impact on the healthcare delivery system? You're asking your opinion. Then it says, support the position with at least two authoritative resources. So remember, and this should be a period, not a question mark. You need two references. So remember, when this is asking you a question, and all of these, it's not yes or just no. Obviously, this is academia, and you need to provide a substantive response. Okay, some of the areas to consider include the impact of health insurance coverage, prescription drug costs, health professionals' scope of practice, emerging healthcare technology, supply chain issues, mental health, Medicare, Medicaid. So those are some areas that says include its impact on here we go. Some areas to consider. So the assignment here is actually giving you some focus areas that you can consider when you're writing your paper. So you do not have to pick all of them, but you do want to pick, a couple, right? Okay. Number two, did the ACA bring the U.S. delivery system closer to universal health care? Right? And if you don't know what universal health care, you can easily Google that and find examples. In other countries, I think Canada has universal health care where it's just you have health care and it's really provided by the government. So answer it and explain. All right, number three. What has the impact of ACA for individuals looking for affordable health care insurance? So that's a question you need to answer. Also, the first bullet, can people make more informed comparisons between different plans? So again, it's just not yes or no. It's answering it and plus explaining your answer. Do you think the ACA makes healthcare coverage insurance more equitable and accessible? Explain and support your response with one authoritative source, i.e. reference. Okay, so that's the detail. And then assignment requirement, opinion paper that addresses the following. Now, these three bullets here align with 1, 2, and 3 here. So discuss the impact of the Affordable Care Act on the healthcare delivery system. Aligns number 1. Discuss whether the ACA accomplished its primary goal. That's number 2 here. And then 3, in the last bullet, discuss the effect of the individuals bypassing the ACA. So these 3 bullets under assignment requirements are basically a shortened statement on what the questions are up here in the 3 bullets and the 2 sub bullets. All right. Citation requirements, minimum of 3 references, scholarly resources, and as you can see, it says 2 up here, one down here, and again, minimum. You can have more. Word count 500 to 750. I posted earlier this week on word counts. Word count's a guide. I look at, did you sufficiently and respond to the assignment requirements? So I've seen some papers where it seems like the student just stopped writing when they hit the word requirements. I'm grading your paper on how you answer, how you thoroughly answer and write your paper. So words, it's a guide. APA formatting. I posted, early class about APA formatting with my video and a sample paper. Make sure that this is thoroughly APA formatted. So let me take a minute. I'll take a minute and go into that. Before I do, what also I want to touch upon is here when it said this link. So when you click the link, it takes you to this. It'll take you to this page here, and it's a good read. It's only 11 pages or so, and you'll get through it quickly. Something to also consider is, like I also posted in class, always look at the syllabus for each assignment. Because, like, for example, it gives the requirements here, right? So it goes through the detail and the assignment requirements in here. So when you go to the syllabus, you can see how your paper is going to be graded. So when I grade, I have the electronic format, and this is basically what I'm grading you on. So as you can see, there's 3 areas of content. Content, opinion of ACA. Content, accomplishment of ACA goals. Content, impact on individuals. These 3 here basically line up with these 3 here, okay? So when I 3-year assignment, content, opinion, ACA, if you're exemplary, skillfully and thoughtfully discuss the impact of the ACA on the healthcare system. Skillfully and thoughtfully. All right. Content, accomplish the ACA goals. Comprehensively discuss whether the ACA accomplishes primary goals. So see the difference here? Comprehensively, proficiently, and over here is not attempted, and this is just discussed, right? So comprehensively, skillfully, and thoughtfully. Third one, content, ACA impact on individuals, comprehensively discusses the effect on individuals by passing the ACA. Okay, so those are the 3 areas on content, and then the next 2, value, source of evidence. Demonstrate consistent use of credible, relevant sources to support ideas that are situated within the discipline and genre of the writing. So the references you choose have to tie to the topic and what you're writing about. Not only have a reference, but you need to use it at least once in your in-text citation. I've seen papers where they just put the reference and then they don't use it as in-text citations. And per APA, you have to use a minimum of 1 time, but we're not just shooting for the minimums here, right? We're shooting for a thorough, comprehensive paper. All right, control, syntax, mechanics, and APA format. Uses straightforward language that generally conveys meaning to readers. Minimal error in grammar, spelling, and other aspects of writing and referencing. Applies the APA formatting and includes references of works cited with a few minor errors. So that's what you're going to be graded on. So let's go back. All right, so when you think about APA, right, and this is all in what I've already posted, I'm going to go through it again. Every paper, because you're at the college, university level, every paper has a title page, period. I also put in there like the key components, what I want you to put on the title page, so you know what that is. So you have the title page. When you go to your, which is page 2, you're going to start off with the paper title. Always have your paper title starting page 2, and in this case, it is Closing the Gap in Healthcare Coverage with the Affordable Care Act. That's your paper title, right? It says page 2 in the upper right-hand corner. Right, that's going to be in bold. Right after that is your introductory paragraph. all papers have, because that doesn't say it specifically, but it says APA formatting. So in APA formatting, all papers have introduction paragraph, your body, which we just discussed, and your conclusion paragraph plus your references. So you'll have your introduction paragraph, and you don't say introduction because it's understood right after the paper title. You go into your introduction paragraph. It's 3 to 5 sentences. That's what construes a paragraph. And then explain to the reader, i.e. me, overall what you're going to write about. Okay? Then you go into the content of your paper. Now it's important that you use at least level 1 headings on your paper that are centered and bold. And those level 1 headers define sections of your paper, right? So each section is a shift in topic, a shift in focus, a shift in thought. And that shift is right here in these 3 bullets. So each section, you should have 3 main sections of your paper, and it be, like for example, right here, impact of the Affordable Care Act on healthcare delivery system. Center, bolded, and all capitals. Not all capitals, it's all upper, it's not just sentence case. So, you know, the impact, capital I, etc. I think you get it. The next section, the ACA, you could say, did the ACA accomplish its goals? Or ACA accomplishing primary goals, something like that, right? Again, center, bold, and then lastly, you can put effect on individuals by passing the ACA. Okay, so that would be 3 main sections. Now, on this third one, because this number 3 here actually breaks it into 3 parts, right? So you're going to address 3 parts under this last bullet. So you would use a number 1 heading to tee up this first one you're going to talk about, and then you can use a level 2 heading for these next 2 paragraphs, these next 2 sections here you're going to answer. And you always want to kind of paraphrase or shorten what your level 1, 2, 3 headers are. Should be no more than just 5 words at most. Level 2 headers should be maybe like 3 words. So when you use this as a level 2 header, then you just need to shorten it to a few words that convey what that point is. And then from there, you're going to have your conclusion. Conclusion says, different from intro, but it says conclusion, centered on the paper, bold, conclusion. Then you write 3 to 5 sentence conclusion. Now, with your introduction is, you know, I'm going to tell you about this, right? Then the content, you tell me. Then the conclusion is, hey, I just told you about that, right? So it's a reciprocal of your introduction. Do not start your conclusion with in conclusion, comma. That's redundant. You've already said conclusion right there in the middle of the bullet. Conclusion, write your paragraph, 3 to 5 sentences. Your references, start a new page, and it says references, bold, right in the middle. Do not say works cited. That's incorrect. It's references. Then you're going to have your references in alphabetical order, properly formatted as per APA requirements. Another APA requirement on your references, if you didn't know, is to remove the active hyperlink. So you know when you copy a reference or a URL and you paste it into a Word document, it automatically becomes active. It's blue underlined, so if you click on it, it will actually launch the page. Well, according to the APA, what you need to do is right-click on that URL, and then it's going to pop-up menu and it'll say remove hyperlink. Click on the remove hyperlink, then the blue will turn to black, and then your active hyperlink is not active, again, according to APA. All right, well, I'm excited. This is a really fun assignment. I hope you enjoy doing it. If you have any questions about the assignment, maybe formatting, however I can help you, you know where to find me. You can email me, which I have on my phone, so I get emails real time. If not, you can always text me as well. All right, so enjoy this assignment, and thanks. Bye.